Okay, so I have my patient here who needs nasotracheal suctioning, and so I have their nasal trumpet here. What I would do is I would measure from their ear, then to the tip of, or the point of their mouth right there, and this one's a little long, but it's just what I have to use. So in order to insert this, I would put a little bit of lube in the end, and then the bevel side towards the septum here, I'm just going to firmly insert that right in. So to determine what size catheter I'm going to use, I'm going to multiply the size of this nasal trumpet that I have here, which is an 8. I'm going to multiply that by 2, get 16, and then I'm going to go one size down. So my catheter that I'm going to use for this is going to be a 14. So I'm going to go ahead, before I start suctioning, I'm going to wash my hands and then grab my suction catheter kit here, and it's going to be sterile procedure, so I'm going to really carefully open this up and just touch the outside of this here. Got these, open it up, and I'm only going to touch the inside of these gloves that are here. So, just touching the inside of those. Alrighty, so I'm going to grab my catheter. I'm going to put some sterile water in this cup here, or this tray. So my left hand is going to be my sterile hand, and then my right hand is going to be my dirty hand. So I'm going to go ahead and wrap this catheter around my hand so it's a little easier to hold. And then using my right hand, which is not my sterile hand, I'm going to hook up my catheters to my suction tubing here. So my suction tubing, or my suction is going to be set for an adult to between 120 and 150 millimeters of mercury. I'm going to make sure that this suction is working. I'm going to suction up some sterile water before we start here, and then get the tip of this wet, so it's a little easier to insert here on my patient. So I'm going to go ahead and let my patient know that this is going to be uncomfortable, and then I'm going to use my, I would just only use my left hand, sorry, to use the catheter because it's sterile. So from here I'm going to insert this, I'm going to insert the catheter in. So that first resistance that I'm going to hit there is going to be the vocal cords. So from there I would tell my patient to cough or to take a deep breath in, and I can keep on going from there. Then that second resistance that I hit is going to be the carina. So before I start suctioning, I'm going to pull back on this catheter about 1 centimeter, and then I'm going to go ahead and apply suction and pull that out. So I'm going to make sure I only apply suction for no more than 15 seconds, or I'm going to hold my breath the whole time I'm suctioning. That way I know I'm not making my patient too uncomfortable. So from after I've suctioned, I'm going to suction up some more water just to make sure I clean out this suction tubing and I don't leave anything in there. And then I would go ahead and oxygenate my patient and then use an oximeter on them.